They on the torchlight. They told my husband that this is your baby, and he's coming with aunt. My husband said, "What will you now do now?" They said, "We will refer you."
They would work more than 400 hours a month. Yet their take-home pay at the end of the month is just less than 250,000 naira for most of the doctors.
The child mortality rate still remains quite high in Nigeria. It's probably one of the highest in Africa as well.
In the wake of former President Buhari's death, many Nigerians took to social media to question the legacy of Nigerian political leaders who often flew abroad for treatment. 2 years into President Bola Tinubu's tenure, has anything changed? Around the world, nations consider providing quality health care for their citizens a true measure of progress. But for Nigeria's over 200 million citizens, quality health care seems to remain a mirage. A 2024 World Health Global Ranking published by Vanguard newspapers puts Nigeria at number 11 out of 12 countries with worse healthcare systems. This is a departure from a 2021 WHO system ranking, which positioned Nigeria at 163 out of 191 countries, an improvement from 187th position over 2 decades ago. These rankings are not just statistics, they represent real people like Temilade Moshood, battling for their lives.
I delivered the first child. It remained the second one. They was just like, where is our husband? Where is our husband? Call our husband, oh. Hey, we have not experienced this kind of issue before. What happened? I was asking them what happened. They said I should sit down. I should breastfeed the first baby. The second baby have not come out. So you're telling me to breastfeed the first baby. And I can feel the head of that baby on my cervix.
Though this happened 8 years ago, Temilade's memories remain vivid.
They wrote a note for him and told him she should take me away. Before they could carry me into the car, I don't even know anything again.
For many Nigerian doctors like Alamin Usman, it is heartbreaking to show up and still not be able to save a life.
It was a Saturday, Sunday call that reached into the Monday. You will still continue the work on Monday till the closing hours before you go home. And while driving back home, I, got into an accident with my car and I fell into a nearby gutter. It was up for me, and that was when I sought, for my master's, and we came to the UK to do our master's, both me and my wife.
These are not unique stories. Across Nigeria, underfunded clinics and broken health systems continue to cost lives.
Health, 2.48 trillion naira.
In 2025, President Bola Tinubu promised to fix healthcare with only 5% of Nigeria's budget. This is a far cry from the agreed 15% mandated in the Abuja Declaration signed 25 years ago.
Sometimes we visit the health centers and there are no medicines available. The government also doesn't have enough number of health workers, both at the primary healthcare level as well as above as well.
We also have invested in procuring equipment, so the basic equipment that you need to be able to provide services. We've also invested in health workers. The president asked us to retrain 120,000 frontline health workers for primary health centers.
Any assessment we want to do will be based on those demands we have before government, which has to do with coherence adjustments. This coherence adjustment has outlived about 3 successive governments.
A doctor currently working on the front lines in a typical Nigerian public hospital anonymously shares his daily realities with Gist Nigeria.
Common equipment and supply shortages we face are those very costly ones like the CT scan machine, and the MRI machine that is used to do some serious investigation.
In its 2024 Health Preparedness Index, SPM Intelligence, a data-driven research firm, ranked states based on readiness to respond to health challenges. Lagos, Ogun, and Ekiti ranked top 3. Sokoto, Kebbi, and Yobe were bottom 3. According to the report, the difference often comes down to how states are using the Basic Healthcare Provision Fund, a federal initiative meant to revive grassroots healthcare.
Currently, they get about 300,000, 750 or so per quarter. That number is going to 600,000 for low-volume facilities and up to 800,000 for high-volume facilities.
I just returned from tour of some hospitals in the Northwest. I mean, Jigawa, Katsina, Kano, Kanda. I mean, I saw the state of our health institution. I'm talking of tertiary health institution owned by the federal government. So we need to improve on our facilities.
When it comes to the welfare of doctors, to an extent, I want to say with every sense of responsibility that we have not had it good.
These inactions are not without consequences, especially for pregnant women and children.
A child comes in an emergency in an emergency pediatric unit, and you know you have to stabilize this patient, you have to put cannula and put IV fluids and all of that. But you have to write out the list of items for the father or the mother to go and buy and then come back.
However, there are also very positive initiatives that have been taken place, which we will see maybe in near future. The changes will be shown.
A 2024 World Bank report published by Guardian newspapers states that over 75% of Nigerians finance their healthcare expenses out of pocket. It also indicates that outbound medical tourism results in significant capital flight, estimated at over $1 billion annually.
What we advance strongly is a universal health coverage to make sure that citizens have unrestricted access to healthcare.
Governments actually came out at a point to say that institutions should get 50% rebate when it comes to electricity tariff. How far has that been implemented?
The lowest coverage of all the health indicators are in Northwest, to some extent in Northeast. So focus more on those areas with highest deprivation.
With Nigeria's average life expectancy estimated at 54.6 years, considerably lower than the African average of approximately 64.2 years and the global average of 73.5 years, how long would Nigerians continue to wait for a viable healthcare system accessible to all? Mercy Frank, Gist, Nigeria.